So, welcome to the Lovefly Podcast. We have Sally Winston and Martin Seif, they're both authors of two very well-known books that people talk about in our Lovefly Facebook group, but they are authors of other books as well. So we'll find out more about that shortly. But welcome to the podcast.
Thank you. Glad to be here.
Pleasure. Thank you.
Thank you. Yeah, we've been dying to get you on for a while because we've seen your books get name checked quite a lot in our the phobics find it very, very helpful to use some of the strategies that you've outlined in your self-help books. But I also understand you've got a range of things, so we'll talk about those as well. But just would you mind just sort of perhaps telling us a little bit about your background and how you got into doing what you do?
Should we start, Marty?
I can start. I went into this field to try to cure myself. I was very anxious when I was young. I certainly had a severe, I certainly had what I recognize now as panic disorder when I was growing up. And I avoided a lot of things. And one of the things that I avoided was flying. And I actually tell people, I thought there were three things, growing up in New York City, there were three things I assumed I would never do. I assumed I would never play center field for the New York Yankees. I assumed I would never play center for the New York Knickerbockers, which is a basketball team. And I assumed I would never fly in a plane. And guess what? Only two of those things came true. I actually managed to get over my anxiety and went into this field. And as I tell people, I turned my disability, with a lot of help from many other people, into a decent career. And that's sort of how I got here.
Oh, interesting. Didn't know that. There you go.
Yeah.
What about yourself, Sally?
Well, I'm sorry to say that I am not an anxiety disorder or OCD sufferer. I got into the field because I just was fascinated by psychology and wanted to do therapy. And I was working at a psychoanalytic hospital a very long time ago, Shepherd Pratt in Baltimore. And I was trained completely differently. So I was the kind of local hired heretic. And there was this amazing woman who was a volunteer at the hospital who wanted to introduce the work of Claire Weekes, who was an Australian family practitioner who had written some self-help books that were really revolutionary. And I got introduced to her work, and then it kind of created a paradigm shift for me. And I set about, with Zelda, the woman who introduced me to her work, set about a specialty program for the treatment of agoraphobia, which then expanded into anxiety disorders and eventually OCD. We left the hospital in 1992, and we're freestanding, but we're still on the hospital grounds.
So how did you two end up working together then?
I just want to say one thing before I answer that. When you go back as far as we do, there was a kind of evolution in the understanding of anxiety disorders. And so there certainly was no definition of panic disorder or agoraphobia or panic disorder with agoraphobic avoidance, the concept of anxiety sensitivity, the fear of fear. OCD was completely misunderstood. I don't want to get into how complicated, how wrong that was. So over time, the field and we also sort of refined our understanding of it and got it to the point where I think where it became more manageable and more treatable, and we sort of had models that made sense. Sally and I met at an organization called the Anxiety Disorders Association of America. Okay. And Sally was very active on the board. I was sort of a member of the board. I happened to be around when it was organized, so now I'm called one of the founders, but I was just sort of young and happened to be there at the time. And Sally and I met during conferences, and we became colleagues and excellent friends, I think, and wonderful friends. Yeah. Okay.
So what prompted the desire to write a book? I mean, there's a lot of books out there, yours is the one that gets mentioned a lot, particularly the overcoming anticipatory anxiety. And more lately, the intrusive thoughts one I've seen popping up in different places that we in our community. So I know there's others as well, but please let people know what those are, because that might also be of interest. But where did that come from?
At some point, I decided that I would try to write a textbook for therapists. I figured that I had gotten to the point where I knew something about anxiety disorders and maybe enough to actually be helpful to other therapists. And the process of vetting it, a manuscript was sent out to other people, and I think a manuscript was sent out to Sally, just the beginning of it.
I was a reviewer for the publisher.
And she had a little thing on it saying, this is the sort of book that I would want to write if I ever wrote a book. And so I contacted her. I said, Sally, it's my manuscript, which you probably knew. Did you know it was my manuscript? You probably knew that. You did?
I'm not sure. I can't remember.
That's a long time ago. I said, you want to write this book with me? And she said, I don't know. Anyway, it took a long time to get her to say yes. I said it was sort of like, you're asking someone out on a date, and I say, well, maybe, and let me see, not sure, and whatever. So finally she said yes. And we wrote a textbook called What Every Therapist Needs to Know About Anxiety Disorders. And, I think we're an excellent team. We really help each other a great deal. And then, so that book was published. And then the next book, which Sally's the primary author, really came about because the next book was on intrusive thoughts. And I had a single page on my personal website on what I called at that point intrusive obsessive thoughts. And at that point, usually this is many years ago, personal websites would get 30 or 40 or 50 or 100 hits a day. And I noticed that it went up and up and up and up. And one year I got about 300,000 or 400,000 hits on my website. They all landed on this one page on intrusive thoughts. And I said, I guess people really are interested in intrusive thought. Either that or there's one person who's just spending his whole day just clicking on that one page for the whole time, And I realized that, and I got emails, I started a newsletter, and then it seemed I said to Sally, let's write a book about it. I think I was the one that initiated that idea. And we were a team by then. And we were a team by then. And that has been a big seller. I think now in 12 or 13 different languages.
Wow.
It's all over the world. Yeah.
Okay.
And we just got a complimentary copies of something. I don't know which book it is that's in Romanian, I think.
Yeah.
And then a Chinese something. They sometimes they're pirated, and but of course we can't check them for accuracy or anything. But the books are all over the place now, which is really very gratifying. The whole point really was that we thought we had something that was actually quite different, and so we would just want to get the word out, and that's what happened. And then
must be very
since
proud.
then there have been a lot of other books, of course.
Well, that's amazing, and to think that global reach.
Right, now you can. I will tell you that there's a rationale behind our 3 books. The first book on unwanted intrusive thoughts are actually obsessions. And we didn't want to use the term obsessions because there are a lot of people who know that they have these stuck thoughts that are bothersome to them, but they don't recognize that they have obsessive compulsive disorder. So we didn't use the term. And those are obsessions. And the next book, Needing to Know for Sure, is really about compulsions, which is the second part of that in some way. And then
particularly checking compulsions and reassurance seeking, and the kinds of compulsions that are not obvious behavioral compulsions, but more internal cognitive thought compulsions, things that people tell themselves to try to lower their anxiety. So there wasn't much out there about more subtle compulsions. People think of compulsions as sort of hand washing.
Yes.
But this was more about the more subtle kinds of ways that people try to make themselves know for sure that the thoughts they were having are wrong or shouldn't be attended to, or undo them somehow. So that was the second part.
So did you know when you started the first one that you were going to do, there was going to be a trilogy?
No. Marty pushes me each time to do the next one. So these are his ideas.
She writes
and
it, she
I
says, good,
dragged
I'm done, I'm
along
never gonna write
reluctantly.
another book again. And then I said, come on.
Yeah.
So that was the second one. And then what led to the third one?
I really don't remember what led to Anticipatory. Who thought it up? Who thought it up? You or me?
It wasn't me.
I think
I'm talking to
I
Sally.
don't
Wasn't
know.
there.
I think again it was you. The third one is really about the third layer of anxiety. The first being fear, the second being fear of fear, and the third being fear of fear of fear, which is the driver of avoidance behavior and anticipation of being in a situation in which you might get anxious and then be unable to function or have to leave or whatever. And a lot of what goes on, of course, with fear of flying is anticipatory anxiety, because most of the agony, and actually most of the agony and most of the anxiety disorders and a lot of other situations also like depression, are the anticipation of becoming anxious rather than the anxiety itself.
Yes.
And I think that's true. I don't remember specifically, but certainly I deal with it personally, in terms of my own anxieties. And I deal with it on a regular basis in terms of people who, are trying to fly in some way, because that's really a perfect sort of medium for anticipatory anxiety to become stronger and to grow in some way. Because a lot of people fly once or twice a year and they say, oh my God, I flew and now I have to fly next summer on my next summer trip or my next winter trip. And they worry about it for hundreds and hundreds and thousands of hours, and then they're on the plane for a few hours at most. So it is a great amount of anticipatory anxiety relating to.
So this is, I'm going to have to ask you a load of questions around this, because this is an area which comes up that people are really interested in this. So forgive me. So is there, if people are interested in the book, is there a particular order that they should read them, or can they just dip into one? What would you suggest?
They all stand alone. For somebody who has OCD, I would suggest starting with the blue one, intrusive thoughts, going to needing to know for sure, the green one, and then anticipatory anxiety. For somebody who's mostly got phobia, and it's not sort of based on intrusive thoughts so much, you might just start with the anticipatory anxiety one. But they were written in the order that would be best to read them. And they're not long and arduous books. The other thing is that our thinking did evolve over the years.
Sure.
And so our most recent thinking is in the orange one. The anticipatory anxiety book is really our most recent. The important thing about looking at avoidance, which is what anticipatory anxiety is pushing for, is that understanding fear of flying really has to do with understanding that it's not all one thing. And the way that you treat, either self-help treat or treat professionally, fear of flying, is to figure out what is the person avoiding so that you can work backwards. Because it might be that they're avoiding horrible thoughts. It might be that they're avoiding the plane crashing. It might be that they're avoiding getting embarrassed and by looking anxious in front of their seatmate. There's a whole range of different ways that people make a story in their head about what could happen that would be bad. And in order to treat it, you have to understand that, and you have to focus on what it is they're actually avoiding, which may not be obvious, because most people think it's the plane crashing, but actually most people are afraid of flying. It's really not the plane crashing.
Yeah.
You know, so
Great stuff.
another way of putting it, I think Sally sort of described it better than I could, but in a much briefer way, you say to someone, look, you could be sitting on the plane terrified, and there's someone sitting next to you just as terrified of you for completely different reasons. Okay, totally different reasons. So it's a misnomer to say fear of flying. I like to say fears of flying, and recognize that the fears of flying, the concerns about flying, is really a confluence of many different fears. And people can have a major one, they can have more than one, they can have several in some way. And you know, just to give an example, I know someone who is who doesn't fly because she's afraid. She has that she's going to blurt out the words, "I'm a terrorist." Okay, on the plane, and she thinks that in that case she would be, you know, sort of deprived of her rights and sent to Guantanamo, and not be able to see her family in some way. So that's the reason she avoids flying, which is very different from someone who's afraid that they're going to either panic, or, and some people are most afraid that other people are going to see them nervous in some way. They have social anxiety, and you know, there's just a long list of people. And in the, you know, I had mentioned earlier, prior to us starting this podcast, that I had, for 17 years, I had run this program, this group program for people afraid of flying, and we'd see many, many different types of people, of different fears of flying in some way.
You've stopped that now then, Martin?
It stopped during COVID for a variety of reasons.
Yes.
There was also, it was through a hospital, and the hospital got rid of its behavioral health. Those are sort of technical reasons. But it was very successful as always. And the people who, what brought everyone together, though, is that everyone could identify with the idea of anticipatory anxiety, no matter what it is. As Sally said, no matter what the scenario that went through their mind that they were afraid of, they all could identify with anticipatory.
But I love that. There's a question that's been on my mind for a long time. It's like, what's the difference between anticipatory anxiety and just anxiety?
Well, I mean,
because in my mind, they're the same. Anxiety is something that could happen. So thinking about it, and so it's quite a technical thing that I've been mulling over, thinking.
The way we've come over, I thought I'd ask the experts. Is that the way we come over? Look, there's no doubt that anxiety lives in the future. I tell people it lives in the future, bites you in the present, but it lives in the future. So all anxiety has some sort of what if component to it in some way. But I think that what we've decided is I believe this is true, Sally, correct me if I'm wrong. We call it anticipatory anxiety if it pushes for avoidance, if it pushes for actual avoidance in some way. Although when people are, for example, in an anxious situation, they're always trying to avoid, but in more subtle ways, you know, as Sally mentioned earlier, you know, the way getting away from the feeling in some way, trying to distract oneself from the feeling or reassure oneself, you know.
But there's lots of things I'm loving about this. So a couple of things though I'll say. So I like that little quote that it lives in the future and bites in the present. That's great.
The one that goes with that is don't bleed before you're cut.
That's great.
Which is what anticipatory anxiety is the imagining of bleeding and then feeling like you are bleeding. A lot of times what people remember about an experience is their horrific anticipation of it instead of it itself. You know, you'll see kids, for example, who are scared of having injections or shots. and they'll be, they can't sleep the night before, and there's a lot of screaming and struggling and misery, and you have to, and holding them down. And then there's a shot that takes 10 seconds and it's all over. And people turn to them and say, so see, it's no big deal. And then the very next time it has to happen, the same thing happens again, because what they remember is that whole anticipatory anxiety, not the actual reality of what the shot was.
Yes.
And they don't want to go through that again, but they attribute it to the shot instead of their own story in their head about how terrible the shot is going to be.
Yeah, that makes
Which
sense.
is exactly why where the fear of flying can be so long-lived and persistent, because in fact you can buy a ticket 3 months, 6 months before and worry about it the whole time in some way,
Which brings me to another point that you've said, which is that you said fears of flying, because when I've looked into some research last year, I wanted to check. Because earlier, when I was first running the fear of flying programs, I used to say, there was this sort of debate: is it a simple phobia? Is it a complex phobia? And there seemed to be different schools of thought around that. But I've always felt like it has to be quite complicated because it's so individualized and it's not one thing. So I couldn't see how it was ever could be classified as a simple phobia. At some point, it was.
Well, there's the occasional person that the only thing they're scared of is that the plane will crash. And that is what gets called aviophobia.
Yes.
And I think that can be classified as a phobia, but most people are not that. Just the same way like with bridge phobia. People are afraid to go over a bridge, but this strange thing happens, which is that people are scared beforehand and they try to avoid it, but they maybe they're driving and they drive and they're extremely anxious on the first half of the bridge. And then as the bridge starts to come down, they stop being anxious and they're still on the bridge.
Yes.
Right, which must mean it's not the bridge. It's something going on up there that changes when you are halfway or coming down, or I guess I might make it, or if I got this far, maybe, and there's something going on there. So it's not a bridge phobia, but it looks like a bridge phobia. And occasionally somebody is afraid that the bridge will collapse, and that would be bridge phobia. But that's not what most people are scared of. They're scared they're going to have a panic attack, or they're going to yank the wheel and drive into a truck, or they're going to pass out or something. They're not really scared of the bridge. And it's the same way with flying.
Very often people will come to you and say, I'm only afraid that the plane will crash. That's all and they'll say, and if you start to talk to them about the concerns that they have in some way, you realize that they have an extremely active imagination, extremely sticky mind, and that they have certain types of imagined fantasies that terrify them in some way. And so they may not meet criteria for OCD, but it's more of a obsessive fear in some way. There is, I think, simple phobia is now a specific phobia. Have they changed?
Specific phobia.
Phobia.
Yeah, you're right. Yeah,
sorry. I've actually never met someone with a specific phobia of fear of crashing. I've never met it. Now, maybe I dig very deep when they come, but I've seen a lot of people who are afraid of flying. A lot of people who are afraid of flying.
I've seen couples who fly separately because they don't want their children to be orphaned of both parents.
Yeah, and you know what I tell them? I tell them if they really want to be safe, take separate taxis to the airport and fly together. That's what I say.
Right, because that's the basic problem, is that in an anxious state, people's ability to do appropriate, real risk assessment is out the window.
Yes.
And they confuse the stakes and the odds. So that if the stakes are something like, if the plane crashes, I die, that's very high stakes. But the part of it, which is 1 in 10 million flights goes down, is just completely lost. They just respond to the stakes
And
as if
that's
that's the
part of
whole story.
that's
Yeah.
part of the the change in perception and consciousness and awareness that occurs when the alarm system is going. Exactly. And without getting into anything technical at all, it's really hard for us to understand how something so complicated can be so safe. It just, sometimes you have to say, well, I guess there are miracles or something like that in some way, and recognize that that just affects us sometimes that
Well,
way.
there is they do fly through the presence of magic. I've concluded that now. I've listened to the pilots explain it so many times now, and I'm still like, yeah, there's got to be magic involved. I don't get that,
Well, the best thing a pilot ever said to our fear flying program was, we used to have this pilot would come all the time. He was afraid of public speaking. So he was facing his fear to talk to us. But he used to say, I just want you to imagine yourself backing out of your driveway on your way to work. That's how I feel when I'm backing the plane out of the hangar. And I thought, wow.
Yes.
And he actually doesn't have to know all the details of the physics of flying. He has to know how to fly the plane.
Yes.
And we know how to drive, but that to me was so helpful and so helpful to so many people that for him, it's completely ordinary.
Yes.
And not magic.
There are lots of images like that can be used, like say you go to your office, the cockpit is the pilot's office. I just want you to know that that's the office. One of the things that a pilot, because we've had lots of pilots talk to us over the years, and one pilot, she said, the plane is made to fly. As soon as the plane starts to lift off, when most people are very nervous, as the plane, is the sky hook going to successfully hook onto the plane and lift it up in some way. As soon as most people, she says, no, that's when the plane is in its element. That's when it's doing what it's made to do. That's when it's sort of loving what it's doing in some way. So that was a wonderful image that she created. These are images that are helpful to people. I don't know if they're heavy duty therapy in some way, but they help people just sort of get over understandable concerns and anxieties.
Well, it's something more constructive to do with your head, isn't it? To have something to think about that than the other.
Well, the fact is that when somebody's extremely anxious and they've constructed this horror movie in which the plane crashes or some terrible thing happens, they get completely absorbed in it, and the rest of the world disappears. And there's this sort of extreme hyper focus on and the belief in that your story is real, or because it's conceivably possible that it's likely. And so people are focused in on inside their heads on their story. And that's so true. a lot of what you do is get them out of their heads and get them connected to the present moment in which no catastrophes are actually happening, and which there's all kinds of other things to pay attention to. And there's all kinds of sensory input, and the what ifs, they don't go away, but they can recede into the background where you're not watching that movie, even though it's still running on another channel.
I also want to say that this is a general rule. In general, anxiety loves ignorance. Okay, I think of ignorance as sort of a playground for anxiety. It's like whatever you're concerned about. If you don't know something, then it leaves room for your imagination to run amok in some way. And so education is important. And one thing that's important, I think, is just to teach people the basics of how their brain behaves. And one of the huge contributions of this Claire Weeks, who I'm sure you know about and who has made such an incredible contribution to this field, is the notion that there's essentially a first fear, which we have very little control over. It's almost like a sensitized fear. It's almost like an allergic fear. There's this whoosh that goes on. And if you leave it alone, it goes away rather quickly. And then there's a second fear, which is essentially amplified by all the what ifs about the first fear. So patients will say, once you teach them about that, I remember one patient saying, I would be taking off and I get this huge whoosh of fear. And I think to myself, oh my God, did the mechanic put the engine on the right way? Maybe he didn't put screws. Is the wing gonna fall off? Is the pilot gonna have a heart attack? And he said, now I get this whoosh, and he says, that's my amygdala giving me the first fear. What a difference. Just, it doesn't change it. It's a completely different focus for him, for this person. So just
is that the sort of stuff that you've got in your book that people, because what I'm thinking is we get asked a lot, you know, particularly the anticipatory anxiety, and quite often your book is recommended, or books. And but I wonder if I could steal a few tips from you now for people that haven't, you know, delved into it. Because sometimes, even, you know what it's like, if somebody's fear is so profound, even just coming onto a website that has a picture of an aircraft is enough to set them off. So they won't read anything with the word anxiety in the title. So we're trying to lure them in and say, it's a good place, it's safe. You know, here's a few things you can think about.
You can also listen to them. They're all on audiobook. If you can't concentrate to read,
Yes.
you can listen. And that, for many people, is a better way of learning.
I'll tell you, the second chapter of the Intrusive Thoughts book, we list as many intrusive thoughts as we can, because we wanted people, because very often we get notes that my intrusive thought, I think it's different in some way. We get these, so we tried to give a comprehensive list. A lot of people find that terrifying, and as far as I'm concerned, that if necessary, they can skip that part, really, in some ways. They find it too triggering in some way. The only reason, quite honestly, if we made the list now, we would include a lot more things, because any stuck thought that feels bad and keeps on and keeps stuck is an intrusive thought. That's what it is. So an intrusive thought is not defined by its content. It's defined by how it feels and how it acts. Feels terrible and loops around and stays stuck. That's all it needs.
And we do make the distinction between ordinary passing intrusive thoughts, which everybody has, weird stuff that comes into your head, and it's almost, some of it is funny, some of it is just bizarre, or, you know, can be scary content, but it just passes on its own. And unwanted intrusive thoughts, which are the ones that get stuck, and they get stuck because you fight them. And the more you get involved with them, the more entangled, the more you're trying to not have them, before you're worrying about what it might mean, and you're analyzing it, and you're working on it, and you're trying to not have it. That's the fuel that keeps it stuck. So the idea that it intrusive, we have many channels, stuff comes in, there's junk in everybody's head. But the junk that gets stuck because you're particularly offended by it, or it's the worst thing you could possibly think of. So that's why you start fighting with it. That's what keeps it stuck. So it doesn't matter what it's about. It's the stuckness of it, because you're engaged with it, that makes the difference. And that's the unwanted intrusive thought, which turns into an obsessional entanglement, and usually a story with a bad ending.
Yes, I thought you were going to segue also into from what you're describing to the more general concept that we try to make clear, is that when we're dealing with anxiety, effort works backwards. We use the term paradoxical effort, that when you're dealing with something in the external world, you want to succeed in something, the more effort you put into it, the greater the chance of success. If you're trying to move something, the more effort you put into it, the greater chance. When you're dealing with anxiety and much of the internal world, thoughts, but specifically anxiety, that relationship is entirely opposite. So for example, the effort to fight anxiety is what keeps it going, okay, in some way.
Love that.
And, you know, we used to tell people you want to surrender to it, which didn't go over well. So I think we use the term now therapeutic surrender, when we try to explain what we mean by it. Because if you say surrender, it sounds like I should just give up and just never fly, or, not do, stop doing. We mean the opposite of that. But the concept that effort is, and that's one of the things that people have to recognize in some way, that the harder they try to avoid anxiety, the more energy they're putting right into it.
Interesting.
It's a important thing. And
That's what David Carbonell calls trying to douse a fire with gasoline.
yes, or getting yourself out of a hole by digging yourself out of a hole in some way. It just works in the opposite way.
I love those. So perhaps at this point, it might be quite nice to say, if you had, it's not as simple as this, I know that, we're going to say, going to plug your books, go and read the books, of course, and do the work. But if there was a handful of kind of top tips that you think people could think about, they listen to this podcast, but they're not quite ready to do anything else yet, what would those be?
Oh, simple.
I know it's a bit reductionist, but
I would say, we don't get, I must tell you that our publishers are always asking us for specific techniques and things, and we refuse to give techniques, really, because there's a big reason behind it, because techniques mean nothing if they're not applied in the right context. But
sure,
in terms of some more general things, I think the two things that are most important in order to learn to overcome anticipatory anxiety, number one is a change of perspective. Number two, and a change in attitude. The perspective is to be able to say in the moment, kind of a metacognitive perspective. Right now, I am feeling anxiety. Right now, I'm having these thoughts. Right now, I'm worrying. I am being able to be aware of and articulate the narrative that's going into my mind about how awful it's going to be should this happen in some way. And just to observe it is an important thing for a variety of reasons. I won't get into details now. And the second change would be the change in attitude, because there's a tendency to avoid anxiety. Avoiding anxiety is essentially the engine that drives more anxiety. So the change in attitude is to lean into anxiety in some way and to allow it to be. And I think Sally made up the term. I think this came from you. She says, commitment is the antidote to avoidance. Didn't you say that? Didn't you?
Yes.
We do a lot of writing.
Yeah. And
the
other piece of it, I think, in the changing your relationship to your experience has to do with letting go of shame, letting go of yelling at yourself, letting go of urgency around this, and being able to slow it all down and take a look at it from a kind towards yourself perspective, because brains do what they do. And if you have a great imagination, this can easily happen. And it isn't something to be ashamed of. It's something to be able to observe in a kind way, so that you can begin to change your relationship with it. And being able to make a decision and stand by it and proceed forward is not easy. But it is the way out.
It's interesting, just to be very specific about that. When I was running the Fear of Flying program, for practical reasons, there was a certain number of group meetings, and then everyone had to buy their own ticket. And we took a group flight, round trip flight, to either from New York to Boston, New York and Washington back. And that's under an hour each way. So we would do it all in one day. I would insist that people buy their ticket right after the first meeting, and they were terrified about it in some way. But everyone noted that once they bought their ticket, there was a little drop in anticipatory anxiety, because the question of should I or shouldn't I, that debate back and forth, should I, shouldn't I, a portion of that was eliminated in some way. And to some extent, there are people who react to anticipatory anxiety in different ways with flying. And I'll give you extreme examples. There are some people who say the day of the flight, if I get to the airport, come hell or high water, I'm flying. And they get to the airport and they're just ready, they're going to fly. They've committed to the flight. On the other extreme, there are people who say, as long as the wheels of the airplane are still on the ground, I have the right to cancel the flight in some way. So they're going through the gate, saying maybe I'll fly, maybe they won't, maybe I won't. They're getting onto the plane, maybe I'll fly, maybe I won't. They're getting in their seat, maybe I'll fly, maybe I won't. They're going, do you understand? And these people are always back and forth, and their anticipatory anxiety continues to to climb. And those are the people that occasionally will get up and get off the plane just before the door closed. You know, it would happen maybe a dozen times.
Yeah, and the way to think about it is that it's more uncomfortable sitting on top of the fence with spikes than it is on either side of the fence.
Right.
Right. So the idea is to commit, will get you off of that back and forth and back and forth. And it actually, shocking to many people, is that it actually feels better. But, you know, there are all kinds of very subtle ways of having a refundable ticket. There's a big difference between flying United and flying Southwest, because there's no change fee on Southwest, right? So there are all these sort of little escape things that people do in their head.
Southwest, can you reserve a seat on Southwest? Not your specific seat. A lot of people need to fly on a certain seat.
Right.
That's right.
Right. But the subtlety of the little avoidance mechanisms, or the little maybe I'll get COVID and won't have to go kinds of fantasies, it's remarkable how creative people can be.
Yes, I totally agree. This has been awesome.
Wow.
There's some really nice sound bites there as well, that sort of shared wisdom. So just to give people some extra sort of resources to go to, we got your books. We'll reference those in the podcast as well, and they'll go out. But there's other places that maybe they can go to. I know that Sally, you said your institute still sees people, and
Yes,
Martin, you don't
yeah.
anymore. He's had enough. Just he's done his time. Don't want to see anymore.
Well, our fear flying program did collapse during COVID. And the person who was in charge of it may or may not be willing to put a new one together at some point. But at the moment, we don't have a formal program. We do have individual work. And very often people who are scared of flying, actually, that's the sort of the thing that they can say about their anxiety and their ticket into treatment, when actually that is the socially acceptable, easy to understand fear. But there may be all kinds of other fears, and they really can be seen in a broader way.
And I also wanted to let people know, in the United States, actually, certainly in the States, there's the Anxiety and Depression Association of America, which has a large website and a finder function for people who specialize in that type of treatment.
There's a fear of flying book by David Carbonell, which is also something people might want to take a look at. He's a colleague that we both have a lot of respect for.
Right.
My favorite phrase of his is, your job when you're on the plane is to be breathing baggage. You do not have to fly the plane. And but his book is sort of short and sweet and full of little things that might be helpful to people as well.
Breathing baggage.
Yeah, and I think the subtitle of his book is Anticipatory Anxiety, dealing with the anticipatory anxiety of flying. I have it somewhere, but I can't find it now.
Yeah.
Yeah.
Did you do the foreword for that? I can't remember.
No, I did the foreword for one of his other books.
Okay. Well, his work is also something people might want to reference.
Yeah, it's good. Yeah.
And what about you two? Is there going to be a fear of flying book coming out of you with your backgrounds? Or are you done?
No,
What's
it's
next?
interesting. We actually pitched it initially and they weren't interested. They didn't feel there was a big enough uh, market for it. I like that there's a book written by that's somehow associated with Qantas that I like a lot. I don't remember the name of it, but it was but I thought it was one of the better books on fear of flying. Um, I think that we're both Sally and I are taking extensive vacations, and then we'll decide what we're going to do then.
And then you can let
Right.
Sally know what you're writing next.
I think
You
she
got
knows.
it.
I've worked out how this thing works.
Yeah.
Yeah.
Oh,
Listen,
amazing.
Yeah.
That's right.
Okay. Very kind of you to be so complimentary to us. Thank you very much.
Well, I just want to say thank you on behalf of all the people. Our group is small, but it's growing. We've got to just over 4,000 at the time of recording this little private Facebook group, and having helped, I don't know, probably 30 odd thousand when I ran my public courses with the flights and stuff. I know that there's a need for more resources, and the anticipatory anxiety is something which is asked about all the time. That and claustrophobia and not being in control, those are the sort of the biggies. And so the work you're doing is really important. So on behalf of all of them nervous flyers, thank you.
Well, thank you.
Well, thank you for having us.
And I'm really grateful for your time. And yes, be awesome. I'll let you know when it's out. But thank you very much.
Sure.
Great to meet you both.
Thank you. You take care.